The hospitals lots of times will offer free resources, music therapy, art therapy, chair yoga, all these things. But having a counselor, I think, is key. And not only for yourself. If you have a spouse or significant other, or certainly if you have children, depending, it doesn't even really matter what age they are, I think it's really important to get them into counseling as well, too, if you can, because they're dealing with their own fears, with their own sadness, with their own grief. Sometimes they don't want to even talk about it to you and burden you with more things, but they're going through their whole process, just like you're going through yours. And having that objective person to talk it through really makes a big difference.
Yeah. I mean, what else does the person need to know, to help them navigate? I mean, I would guess people are impatient. They think, I guess they would think like death will be imminent all the time when it may not be, and they just want to get it over with and they can't take it anymore. As someone goes along with cancer for, let's say, 6 months, a year, maybe now it's 2 years, does the battle change? What does it look like if they've been through a bunch of treatment and things don't look like they're working? Or if they go into remission, then it comes back and, now they're like, now they're really devastated. Do you go that far in the book?
Yeah, I think, well, let's kind of break it down. So when it comes to work, right, it's scary. If you're a sole breadwinner or if you're the major breadwinner, talking to your company supervisor, your HR department, as soon as you can, once you're able to and have an idea. I mean, you have no clue sometimes what's going to happen, when you're going to feel well, when you're not going to feel well. But having that conversation is really important so they understand and you understand. So if there's certain paperwork that you need to fill out, do you understand what your insurance covers, what it doesn't? It helps you plan from a financial standpoint. It helps you plan from an emotional standpoint. So having that conversation with your HR and also knowing what kind of resources your company has regarding employee assistance program or counseling, all those kinds of things is really key. So I think that's important. Certainly, as you mentioned, we all have a different road, right? So, you can go through remission and then you relapse and vice versa and back and forth. And some people have to go through a certain point where there is nothing left for them to do. They have reached the end of the road. That's why, again, you have to have a really close relationship with your medical team so they don't give you false hope. There's certainly different kinds of trials that are out there and, so many advancements with medication and treatment and targeted treatment and chemotherapy. I mean, even in a year, I have a mentor, and I mentee other people, as I mentioned, and his process was so different than mine. And we had the exact same issues. So, being hopeful because things are changing so rapidly and in a positive direction. It depends on the cancer you have, the staging, your health, any kind of pre-existing issues that you have. But certainly, when you get to that point, which hopefully most of you don't get to. I mean, we used to think that cancer was a death knell the moment that somebody gave a cancer diagnosis, but there's so many people, Richard, walking around with cancer and that are survivors and thrivers as well. But for those who reach the end of the road, it's talking to your caregivers, it's talking to your family, figuring out what works for you, your plan. Do you want to be home? Are you in hospital? Do you want to have any kind of medications to keep you comfortable? And discussing this with your medical team as well as your family is really important. And that's rough. There's no easy way to put around that. It's very rough and scary. The other thing I would mention to people when they're first diagnosed is don't be afraid to ask for help for sleep. It's very hard to sleep when you're first diagnosed. And even as you're going through treatment, because of that unknown, because of that fear, because of the sadness and the grief, when you start to go to lay down and go to bed, your head starts to race. And it's normal. So I encourage people, nobody wants to be on medications unnecessarily. And obviously you have to get everything approved by your medical team, but to ask for help for sleep, whether it's something that's prescribed or over the counter, because you really need rest. Rest is important. Exercise is also very important to the best that you can do it. When I was in the hospital, I was hardly ever in my bed. Even on days that I felt like horribly, I forced myself to get up and walk. Mind-body connection is huge, huge. And those of people who work with cancer patients tell you it's a big game changer. And it's hard, you can't always be the glass half full. You have days or weeks or months sometimes when you just feel horribly physically and then emotionally, and it's all connected. So making sure you get sleep, making sure you get good nutrition. Lots of times your hospitals will have nutritionists available for you to talk to. I think that's really important, especially when you're dealing with chemo. And, chemos are a lot better than they used to be, but, you're still going to have nausea. You might have other kinds of things like nausea and diarrhea. It's so important not to get dehydrated. And they have options to help you with IV fluids, but you have to be in charge of you and you know your body better than anybody. So again, you you don't want to wait until it's too late. You want to jump ahead, be proactive versus reactive before it kind of goes down a road.